So I'm going to talk through a couple of things related to pharmacy in general and what you can expect if you're really to brand generics as you enter the retail space of pharmacy, and hopefully give you a few tools to be successful in that space and approach it with the least amount of frustration. As we know, the retail pharmacy is often the last stop in the healthcare process, and it can be very frustrating at times for both patients and the retail pharmacy staff when they run into struggles with insurance and making sure that they can get the medication to you. So the first couple things I want to talk about are just some retail pharmacy insights and what pharmacists can and can't do in that space. So as pharmacists, one of our key roles is really navigating that substitution process and practices. We do follow state laws and insurance rules for generic substitution. When making that decision, whether or not a generic can be substituted for a brand name medication. It isn't always straightforward, I will preface with that. And some states require a patient or prescriber consent, and insurance formularies can definitely vary widely, whether we have government payers, with TRICARE or Medicaid, and then also commercial payers. So each patient is a unique challenge in identifying what insurance will pay for their specific medications, and all of the formularies are different. Inventory is another challenge. Not every pharmacy stocks every medication, whether it's brand or generic. And if a patient needs something that we don't necessarily have in the store, the pharmacists are great. Pharmacy technicians are great at working to find alternatives or source it from another location. So if you're looking for something specific that you know your insurance will pay for, that a pharmacist is a great resource in doing that. I will also share that specific, because I know in the neurology space, there are a lot of controlled substance products that are available for therapy. And we are facing unique challenges in the pharmacy space related to the Drug Enforcement Agency placing total production restrictions on certain controlled substances or all controlled substances. And so as we move through the year, those allocations start to dwindle, and we have been starting to notice that we have an uptick in drug shortages in the later parts of the year, and we are correlating that to these newer restrictions that the DEA is placing on drug production or import production of the active pharmaceutical ingredients. So you might see that in things like lorazepam or your cannabidiols, things like that in the neurology space. So the latter part of the year has been proving to be a little bit more challenging over the last few years for that reason. And the next thing that pharmacists are great at doing is the counseling aspect. It really is an essential component. So if you're checking out at the pharmacy counter and they in some states, the law is that with first dispense, they have to counsel and give you the information that you need specific to that medication. But on repeat dispenses, that is not required, but they'll often offer counseling should you have any additional questions. One of the key things in this space is that generics, as Dr. Valeriano mentioned, definitely look different due to those trademark laws. And inactive ingredients can vary. And I agree with Dr. Valeriano in that oftentimes it's very rare that the inactive ingredients will trigger allergies or things like that. But there are those instances, and so making sure that we're sharing that with you all. We definitely try to help patients understand those differences so you feel confident in your treatment. So next slide, please. So tips for talking with your pharmacist. I wholly encourage to ask if a generic is available. It might work the same and cost less. And in the I've been a pharmacist for 13 years. Actually, I've been here 13 years, so 14 years. And I've worked in pharmacy since 2004. So I've been in this area 21 years, in this space 21 years. And I started in retail as a pharmacy technician. And so that is something that I will say that I've seen over time, and as I've advanced in my career, is that um, things change over time, and I have seen a more acceptance of generics as I've progressed in my career, because most of the time they do work, and Dr. Valeriano didn't get into the specifics, but the FDA requires that in their bioequivalence testing that the drug companies and manufacturers prove that they are within 80 to 125% of the active ingredient in the product. And when that is tested, either in vivo or in vitro, which means in the body or outside the body, that there is no clinical significance, a significant difference between that. So the effect is the same, whether you're getting the brand or generic. So I always encourage everybody to ask, is there a generic available for this? Because it could ultimately save you money overall. It is important to share allergies or sensitivities to certain things. So some generics obviously have those different inactive ingredients, as mentioned earlier. And so sharing that information with your pharmacist is very helpful in doing that digging and deep dive as to, oh, this may have something that you have mentioned you have a sensitivity to. Dyes are a big one on that we see here in the hospital, that we will often run into with different product formulations. I would expect changes in appearance. I think that's a fair assessment. Is changes are to be expected. Appearance is expected to look different from manufacturer to manufacturer, but just know that by law and through the FDA's regulation, they will still work the same, or they should still work the same. Second. Apologize on the overhead page there. And lastly, I would say ask for help finding your medication. So if you've asked, or if you have a prescription for something and you end up on a product that works well, we can help you to locate or suggest alternatives to the medication if it's not in stock at the store. From retail chain to retail chain, we can transfer medications, do things like that to help you find that medication in stock somewhere else. Next slide. So for insurance costs or insurance and cost considerations, formulary navigation is something that is a challenge. As I mentioned, you do have different formularies for different drug plans. And so it's often the deciding factor on whether a patient receives a brand or generic medication. Pharmacists can help navigate the tiered formulary aspect of things. And so within the medication formulary, there are different tiers, and with certain tiers being more preferred. Tier 1 drug is the preferred drug. And then it advances from there, tier 2, tier 3. And they categorize those tiers by cost and coverage levels. So you may be prescribed a tier 2 drug, and what they may require you to do is what they call step therapy, and want you to try the tier 1 drug first before moving on to the tier 2 drug. So that's where you get the prior authorization process that comes into play. So if a medication is not covered, the pharmacy staff will communicate with the provider and help support the medication need through documentation of clinical notes. And so the pharmacy often will reach back out to the provider and say, hey, this medication requires a prior authorization, and this is what they're asking for. Or the information will be passed back to the doctor to fill out forms that are required by the insurance company to establish that a certain therapy is clinically appropriate and required for that patient. Oftentimes those prior authorizations are approved. Many times they are not. And so if they are not, you move into an appeal process where your provider has to submit additional documentation or have a phone call with the insurance company and what they call a peer-to-peer. Pharmacists also participate in these calls if you have a pharmacist that works with the provider in that space to do the peer-to-peer to support the medication use in that space. The other thing that is available from a cost standpoint are that some manufacturers provide financial assistance through different programs and offer coupons for reducing the cost of that. So they sometimes partner with the insurance and they'll cover the cost of the copay if the copay is in a higher tier, or if you can't get coverage at all, they do have programs to reduce the burden on the consumer. And then the other piece of that is foundation assistance. So different medical foundations within different disease states will often have some assistance to help pay for these more costly, newer costly brand name drugs that don't currently have a generic out on the market. And so I think those are great things to keep in mind as you move forward. So go ahead and advance the slide. So some tips for talking with the insurance company is that you definitely want to check your formulary coverage. You can call the insurance company and ask, is this medication covered and at what tier? And that will give you a great start at what to expect once you hit the pharmacy, and another good conversation starter with the provider when that medication is being prescribed. You can also ask, will this require a prior authorization? Because that will also give you some guidance as to what to expect and how long it may take to actually get the medication. You can ask about the prior authorization process. You can ask the insurance company what documentation is needed if coverage is denied, so that you can be a great advocate for yourself and support even your medical team or the pharmacy in saying this is what they're asking for in order to have this new medication covered. You can ask about copay assistance. Sometimes the manufacturer does offer those coupons or may know of a different foundation support for specific medications that are newer to the market. And then understand the step therapy. You may need to try a generic or even a whole different medication class before a brand is approved. So just know that they have insurance companies have specific requirements within their formulary to drive high clinical value care and to ensure that we are trying the most cost-effective way of managing the different disease states. Go ahead and go next. I know that Dr. Valeriano talked about therapeutic monitoring, but I also want to kind of touch on the pharmacist side of things related to neurotherapeutic index drugs. This, as he mentioned, is just close monitoring for drugs like warfarin, levothyroxine, or in our case, anti-epileptics. And I think something that's really important to call out here, specific for the population that I work most closely with, is that age does matter in these cases. But I really appreciate how Dr. Valeriano approaches equivalence issues and ensuring that we are, when switching from a brand to a generic or even generic to generic, that we are monitoring patients very closely to ensure that their drug levels are adequate and continuing to be at the level that has allowed for control of seizures over time. But pediatrics have a very unique metabolism and how they process drugs, and it varies by age. And so how a neonate or a brand new baby processes a drug is very different than how a school-age child processes a drug versus a teenager processing a drug. So that we are very careful in how we approach these different populations with neurotherapeutic index drugs. The other things that are available to patients are things like medication therapy management. There are just different programs that where a patient can meet with a pharmacist to really assess efficacy, safety, and adherence to medications, and work with the provider or many different providers to streamline medication therapy, recommend different lab tests that we could run to help monitor and make sure that we are doing the best for patients in their therapy. And in the newer space, pharmacists also may have collaborative practice agreements. And so if you see a neurologist in a specialty clinic who is managing your care, there may be pharmacists that work with the providers in that space and have collaborative practice agreements where the pharmacist is the one that's doing all the medication therapy monitoring and ordering labs or different tests that ensure that we have adequate management of the medication therapy. So I wanted to share some reliable sources for patients, and you'll often hear people joke about Dr. Google, and there is something to it. And as we enter the age of AI, I think there's a lot of risk in using AI to answer medical questions. Though the different models are getting better and better, we want to make sure that we are looking at the most validated references. In terms of equivalence, the gold standard here is what is called the FDA's Orange Book, and you can access that online, but you'll have to do some reading to understand how to read the charts. But it is a resource that is available, and you can ask the pharmacist at your local pharmacy about the Orange Book rating. What is the Orange Book rating for this drug to the drug that I'm currently taking? And this is the resource that tells us what level of equivalence these different products have as you're switching between product to product, or if you can even consider them equivalent at all. Other reputable drug information websites include Medline Plus, drugs.com, and Daily Med. I'm in Daily Med in my role almost every day, looking at equivalence and as we're onboarding different drugs into our system here. So if I can't find something in Orange Book or something's not clear to me in Orange Book, I often will reference these other websites to help get to the package insert, which will give me additional information to base my assessment. So these are very reputable spaces that you can go read about the drugs that you're taking. And then obviously the pharmacy counter help desk. Pharmacists are accessible at your local pharmacy. I would say maybe a little bit less accessible now than they once were, with Rite Aid closing and all of those scripts going out to other pharmacies. That's put that has impacted other retail pharmacies. And we've seen that several times kind of throughout over the course of my career. And then also many retail chains will offer a toll-free support line. So that is helpful as well. If you can ask your pharmacist at your local retail chain if that's something that's available, or even an independent pharmacy, if you can go there for help, or if they're aware of any other resources where you can go to find help. And then, as I mentioned, in many specialty clinics, there are clinic-based pharmacists, and these pharmacists may, and spelled that, they may be an employee of these clinics as part of the medical team. And we have that resource here at Valley Children's where we have a pharmacist embedded in our specialty clinic that supports all of the medication use process and sees patients and prescribes different medications, makes medication adjustments based on a collaborative practice agreement that is available to them. And that has also helped with access to the care team. So if you're seeing a specialty clinic, you may have interacted with a pharmacist there. And then lastly, state boards of pharmacy. I think these are often forgotten about resources. They are great for regulatory and safety updates related to different medications and what is allowed for pharmacists to do at the retail level. Go ahead next. So just some key takeaways from my point of view. I think that pharmacists really do play a vital role in the substitution decisions, overall inventory management and patient counseling about generics and brand medications. And so use your resources. The pharmacists are happy to go over the medications, talk about the medications, look for interactions between your different medications, and then help you really navigate this brand generic process. They know that insurance coverage really does drive the access. So when you get to the retail pharmacy and they're telling you, oh, it's not covered, it's not something that the retail pharmacy staff are making that decision. It's really the insurance company that's driving that access. And so with the different formulary tiers, prior authorizations, and that step therapy, it really often determines what you as a patient receive. And there are ways that you can work through that with the pharmacist and your provider to get to what your provider feels that you need to best take care of you. I think communication really is key. Ask questions. I think it's so important that you feel empowered to ask questions about your care of pharmacists, of your providers, of the insurers, because really we're all here to serve you. Ask about substitution laws, about what the inactive ingredients might be between different products, what your coverage might be, and what assistance programs are available to you. And then lastly, I think monitoring really matters. And I, again, want to give kudos to Dr. Valeriano for how he approaches therapeutic monitoring, especially for these neurotherapeutic index drugs in the neurology space and also in pediatric populations. They really do require very close oversight. And you have options such as medication therapy management programs to help support that. And so next slide, that would be it for me. And these are the references. So as time goes on, these are links to the main websites that I think are very reputable and will offer great information.